in the agency? Do you know? If
No,
you know.
I don't.
Why you're speaking of now headcount is people served or
Okay.
professional
No.
employees?
Professional employees.
For OPWDD, we have approximately about 4,800 professional employees that work for OPWDD. That's down significantly. To answer your question about the 255 FTE that our agency is predicting, I went to a briefing. Well, I didn't go to a briefing. We called into a briefing about 2 weeks ago, and the agency had indicated that that reduction was coming from the closure of the Broome Developmental Center, as well as some hospice changes on Long Island, in that those, although we have worked very hard to retain our members, and the agency has been very cooperative about that. When people leave, they don't replace them. So, you know, it's through attrition, but it is through a lot of their initiatives of closing or downsizing our facilities.
And there's no discussion of redeployment of staff?
Redeployment of staff, now, in particular, the closure of the Broome Developmental Center, the closure of the Capital District Developmental Center, the ODHEC campus, the Taconic campus, all those professional employees were redeployed to other locations. There is a huge initiative going on Long Island right now that involves 11 houses that are ICFs that are going to be converted and turned over to a private agency. We have approximately 40 people identified that are going to be impacted by that hospice transfer, and we are being told that those people will have jobs within the Long Island DDSO area, which is approximately 3 counties, I believe.
Again,
guess
a lot of this is really for the workforce hearing, so I'm hoping you guys will be here for that, and we can kind of take that up then.
There's one other thing that the nature of the services and the transformation process is that we put more people out into the communities so that we have our finger on the pulse, so to speak. And what ends up happening as a result of that is we have more referrals. We have more people to treat. And without doing a corresponding increase in the services that even OMH provides, but also other providers in the community, then what you end up is you're letting people, you're opening the floodgates and you're not managing the water flow. And that's what the real challenge is here, is especially when we have budgetary constraints, is to be able to allocate monies for those people you have now identified through your very good services in the community. There's no doubt community services is where we're at for the most part, but we have to be able to get those services once we identify them.
Thanks.
Mr. Abernathy.
Thank you, Mr. Chairman. Thank you both. I'm going to talk a little bit about the Justice Center. Since they haven't been here themselves, I'm frankly concerned that if there's nobody in the Justice Center who can come here and tell us what they do, then I'm wondering who's running the place. I know there was an untimely death, and that's sad, but somebody's got to be running the place, and somebody should be up to speed enough to be able to come answer a few questions. I have yet to hear any reason for having the Justice Center. This is an administration that is very good at positive public relations. I have yet to hear any reason for our putting any money in, for reappropriating any money for the Justice Center. I've heard all kinds of things that they've done wrong. I'm hopeful that they're anecdotal, but I've yet to hear a reason for refinancing them, period. And I want to go off on it. You guys represent professionals. Do you have any understanding of what professionals are on the staff of the Justice Center?
Is your question, are there professional employees employed by the Justice Center? Yes, there are.
What types of employees do they have?
And again,
do you represent anybody there?
Yes, we do represent people at the Justice Center. And the type of people that we represent at the Justice Center are primarily the call center people, the people who do the intake calls. We also have a limited group of investigators, and there's a whole array of investigators in the Justice Center as part of that component. There are investigators who handle criminal matters. Then there are investigators who handle.
Do any of them have degrees in the human services area, like psychiatrists, psychologists, social workers?
I couldn't answer that question. Most of our members who are affiliated with the Justice Center, who are investigators, were people who formerly worked for the Commission on Quality Care, who then kind of transformed over there and are.
But you would represent any.
We may be able to get those numbers through our employee database.
Because the stories that I've heard about the way they investigate alleged crimes, and I'm concerned about the people who are the victims. Okay, you can defend the employees. I'm worried about the victims, okay? And when I look at what I hear, how they send former district attorneys or former cops in to inquire, it's like an inquisition of people who cannot express what's going on. They're very limited in speech. They're emotionally upset as much by the investigation as they are by what allegedly occurred. I'm saying, well, who's running this place? And that's why I'm trying to probe, are there any psychiatrists, doctors, is there anybody over there who actually understands the people who you service? And so when they're investigating, it's not just the DA's office coming in, you know, or mini DA's office, whatever it is, but it's actually some people who understand the needs of the people. And that's what I'm trying to gain, and I
can tell you through OMH, the labor management process, that we've had discussion with management about making sure that the Justice Center, the people who conduct the interviews and evaluate whether things fall within the abuse range or neglect range, is to teach them more about the population that we serve, and also what type of training and what kind of physical maneuvers that we might have to do to help to manage certain situations, so that there can be a distinction made between managing in a prescribed manner versus actual out-and-out abuse of some sort. So we're trying to help them to educate.
But you're just confirming my concerns. You're basically saying that your people who are going to be investigated by the Justice Center have to teach the Justice Center enough so that they can understand the circumstance that they're investigating.
Yes. In some
And
so they haven't hired the people who would have that expertise in the first place?
Well, I guess to answer your question, and there are people. I know that we have actually some nurses who have left our agency and have gone to the Justice Center and oversee the investigations that involve nursing and the standards of nursing care. I will relate an issue to you because I think it's important. An investigator came and was investigating in a situation at my facility, and they were interrogating a physician. And this is a board-certified physician, has been in the field for many years. And the investigator said, well, I understand blah, blah, blah. And he said, where did you get that information from? And her response was, I read it on WebMD. And he said, are you serious? You want me to respond to something that you read on WebMD that may have not been anything written by a physician, and you're asking me to respond to that? He said, I'm not going to. Unfortunately, the Justice Center found that physician guilty of a charge. Now, again, when you're basing your questions, your interview technique, on something you read on the computer. And I understand that the world of technology has advanced by tenfold. But again, I understand your question.
And it becomes even worse when you're dealing with people with disabilities who are now surrounded by a group of guys or women who they've never seen before, who are throwing questions at them. And these are people who have enough problems dealing with the real world when people are being nice to them and being helpful and whatever.
And these are people who, some investigators are former policemen, and probably to the fault of our organization, we probably haven't spent enough time in educating law enforcement people and how to deal with developmentally disabled people. It would seem like it should be, but it hasn't. The agency and the Justice Center, I believe, are going to develop a program to expand that to how to deal, with police agencies.
That should have been something before they set up the agency, not after you've gone on for 2 or 3 years. And
well, I would agree with you. I think that what happened is I think that there was a response to major issues that occurred, and instead of kind of putting the cart first, we put the cart second. And I would agree with you. I think that we kind of put the cart before the horse.
I think we raised the issue, and
now
we're running out of time. Thank you.
Kind of backpedaling.
Thank you.
Any senators? No. Mr. Bronson?
Yes, thank you, Mr. Chair. First of all, I agree with Chairperson Gunther that PEF should be on the Transformational Committee. You're a key stakeholder in this. You have the expertise, and you should be part of the discussions as we try to move forward with transformation of our services to folks in our community. I want to talk a little bit about what's been happening. I think, Virginia, you touched on this a little bit where you gave the example of the number of people in the emergency room. I represent an area that includes the Rochester Psych Center. In Rochester, we have had a lot of discussions with the commissioner and with others in the agency about how to move that facility forward. It's a gem. It provides wonderful services, in large part because of your members. And there's always been this tension between increasing forensic beds and reducing the general beds. Does PEF have a position on how you balance the needs of those two beds, but in particular, how that then relates to the increase or additional supplemental community-based services that may or may not be coming to fruition as we move forward?
It's a hard question because I think a lot of us, I teach in children and youth. I've been there for over 25 years. And I do think that just if you think in general, the emphasis is going towards treating mental illness at a younger age so that we can help to teach children to manage their illness in ways that would improve their lives. If we're talking about a forensic population, depending on whether it's adults or children, I think if we're talking about children and there's a better opportunity to improve their lives going forward, I guess I can't speak for all of PEF, but I think that the general thrust is thinking if we can treat these earlier, that we can help them longer. Mm-hmm. And maybe cost-effective down the road. It'll be less investment. And we always have to think down the road when we talk about treating people, is who we treat today may not need treatment tomorrow if we get them at an early enough age.
Could you speak then to the assessment plan that's done for a particular person prior to having them be transferred into the community, and whether or not the lack of staffing has had an impact on the quality of those assessments?
I guess I would like to say, as it relates to PEF employees, I think for the most part, we're going to go tooth and nail against someone who might make a determination that we think is questionable. I mean, we have had those discussions in our treatment teams. It's a regular part of discussion about whether or not the timing is right, whether the timing is right for the families, whether the timing is right for the individual. I think the analysis is still the same, which is, are they a potential danger to themselves or others? And to the extent that we can be reasonably sure that that's the case, then and we set up the contacts. I think they're better than they ever were in terms of what we call a warm handoff or wraparound services, and then the checks after they're discharged. I think OMH has done a commendable job trying to understand that whole dynamic, that we have to kind of put a blanket around them before we send them off. And so I don't think that we've been deterred too much. I don't think in children and youth that we're pushing them out. It's questionable with some of the adults. I've heard some horrific stories about, and some of our people who work in the communities with adults, the whole housing issue, the whether or not they have enough of a stipend, and then there's some complications about rules that will disallow them to even make use of beds that are available. Because if you have to have 30 days for, 30 days without admission, and I don't know all the intimate details of that, but there are services out there that once we discharge, they're not available. They say they're available, and maybe they're available, yes, but do they meet the criteria to use them is the next question, right?
Yeah. Thank you. We're out of time. I will just note for the record that we've had some concerns up in the Rochester area from your members who are trying to help that assessment and the placement, and more at the end of the placement piece, which you just started talking about, that folks are ending up in places that probably are not the best fit for them and for other folks who might be receiving services from that agency. Thank you.
Thank you.
Mr. Saladino.
Thank you, Chairman. Just very briefly, because in essence, an effort to respect the time and the fact that our chairs certainly deserve and have earned a break between the two budgets hearings today, I wanted to pass along just a statement, not a question, no need to respond, but please take this back, and I'll also be reaching out to the acting commissioner. We have this tremendous problem in our community where a placement was coming in through an agency, and I realize that you represent labor, but very, very important. The agency that was doing the placement was not being transparent with the community. My office received 50 calls. We tried to reach out every time I mentioned the community wants to know who will be placed there. We got this stonewalling answer. We must protect their identity. We must protect their confidentiality. And they didn't realize by doing that, they were creating a much bigger problem with anxiety and fear. We've been told by you, the professionals, time and time again, that the best way to help someone's progress is to integrate them into a community. When you strike fear in every resident, you're hurting the opportunities to integrate into that community. So we held some meetings. I had to manage the meetings. We were told in the beginning, we can't release any information. People went on the website and saw that this agency places those with drug addictions, places those who are coming out of prison, places sex offenders, and on and on and on. So of course they were filled with fear. And they didn't get or didn't want to embrace the fact that if you allayed many of their fears, right from the beginning, it would have been such an easier transition. And I will be talking to the commissioner about the importance. The community didn't need to know their specific background. They just wanted to know that it wasn't someone that's coming out of prison, that it wasn't a sex offender, and that list went on and on. They were good people who, not that someone with a drug addiction it isn't, but the point was there were folks with mental illness. And the community understood that. The next door neighbor worked in the field, but the failure of them to admit who was coming in and give that general information would have made such a big difference. And this goes back to what my colleagues spoke of in terms of training. I'm not a CSW, I'm not a psychologist, but it's not difficult for me to figure that out. Why is it that these trained and paid professionals couldn't figure that out or chose not to is mind-boggling to me. At this day and age, with year after year of funding these programs, year after year of learning of their importance, how we're not dealing with the anxiety of a community by just simply giving them enough general information so they want to embrace who's coming in. To me, this is a no-brainer, and I appreciate you bringing this back to your agency.
Thank you.
Thank you.
Any more? We just want to sincerely thank you for being here today.
Thank
you so much.
Thank you.
Thank you very much. Thank you.
I'm waiting.
Association for Community Living, Antonia Lasicki, Executive Director.
Good afternoon.
Good afternoon.
Thank you very much, Senator Young. Congratulations on your new position.
Thank you.
Thank you to Assemblyman Farrell for this opportunity to submit testimony, and thank you to all the committee members, and particularly to the Chair, Assemblywoman Gunther, and Senator Ord. The Association for Community Living represents more than 110 providers of OMH residential opportunities, and that represents over 90% of all the housing that is funded and licensed and under the auspices of the Office of Mental Health. I'm going to just, I have a summary of my testimony, but you're so interested in the Justice Center. The Justice Center is not part of my formal testimony, but I thought I would say two things about that. When the Justice Center was first formed, there was some, I mean, you can almost understand why, because the state agencies were providing oversight to their own facilities. So that was seen as a conflict. There were some terrible abuses in one of the state systems in particular. And so the governor decided to create the Justice Center and make it and make it provide oversight to the entire system, not just the state agencies, but also to the community-based providers that are under the auspices of those 6 state agencies. We suggested that maybe they start by just providing oversight to the 6 state agencies and their operated facilities, where they could start and learn about those and let the state agencies continue their oversight of the community-based providers where there's no conflict. Because the state agencies provided oversight to the community, the Justice Center could have provided oversight to the state agencies, and we all would have been separated. There wouldn't have been a conflict. Instead, they flipped the switch on one day, 2 days after the regulations were finalized, for the 6 state agencies and their entire systems. And it was frankly chaos. There was chaos for a very long time, and it was very upsetting. And I have to say, it reminded me quite a bit about the early days of the OMIG. And the only way that the OMIG changed, and that whole thing got under control, was because the legislature held specific hearings just on the OMIG, and that changed everything. So we in the community thank the legislature wholeheartedly for having done that, because it changed how the OMIG did business. We got a new inspector general, protocols were developed, standards were developed, and there became some sort of uniformity and some rationality to that process. I would suggest that maybe you hold hearings just for the Justice Center. I think that you would have lists of people signing up. You might have to go for days. So I mean, you know, in the beginning, it kind of made sense on some level, but it just got quite out of control. So that's the Justice Center. But my testimony, I'd like to summarize. The mental health housing system under the State Office of Mental Health has continued to erode to unacceptable levels. In some licensed residential programs, we have staff-to-consumer ratios on overnight and evening shifts of 2 to 65, 2 staff people to 65 clients. In smaller programs, it's 1 to 14. These programs serve those with the highest needs, including the need for 100% supervision of multiple and complex medication regimens. We are facing an epidemic of K2 use, fatigue from the police in responding to our calls, and a state hospital system that does not hold on to people for long, sending them back to stressed community providers. In summary, we're asking for $92 million to be divided among 4 residential models. The detail is in my formal testimony that I provided. There are charts in the back of the testimony that show the erosion due to inflation for all the programs, as well as a formula for the development of an adequate rate for one particular model, supported housing, in each county in the state. We're happy to meet with any of you to explain the charts in more detail. We really don't have time to do that here. Second, I'd like to address the governor's $20 billion housing proposal. The governor has described it as $10 billion for affordable housing and $10 billion for 20,000 units of supportive housing. I'd like to focus on the $10 billion for supportive housing. First, you have to take $7.8 billion off the top, because that is money to sustain what has been developed over 30 years. None of that is new money. So out of the $10 billion, 7.8 is just to continue what we've got. And he put that in there, and the staff at OMH will tell you that he put that in there just to sort of show people what the ongoing commitment the state has made to supportive housing. So that's nice, but it's not new. So nobody should think that it is. Then there's $2.4 billion for 6,000 new capital units, but first, that money will be raised through bonding, and then the developers must build them. I'd say it's safe to say that those units will not materialize for at least 3 years. Then there is a promise of another 14,000 in years 5 to 15 that has no money attached to it at all. So it's 20,000 units to be developed over 15 years. There's $2.4 billion for 6,000 to start. Those are going to be bonded and not developed for quite a long time. The remaining $200 million consists of $74.5 million that was allocated last year that they intend to use for operating and services for the 6,000 units that will be built in the third or fourth year, whenever they get built. So that money will not be spent anytime soon. Then there's $75 million to be added to MRT housing in years 3 to 5, so that money will not be spent in the next 3 years. And then there's $50 million for capital for homeless beds, and we think that $50 million is meant to renovate state properties so that they can create 1,000 new shelter units. Because none of this money will be used in the near term, and not one bed will be created, probably not for 3 years. We suggest that some of the money be used to create some scattered site supported housing beds. So scattered site supported housing beds can be online within 6 months. It could also be redirected for rate increases and replenished later when it's needed for the capital beds. One of my other large issues was minimum wage. You've heard a lot about that. Everything that everybody has said about minimum wage also applies to us. The compression factor is acute. We're very concerned that once you bring somebody from $13 an hour, which is quite a few dollars over the current minimum wage, to $15, you have to make sure that the person is the same percentage over the minimum that they are now. So if they're 40% over the minimum now, they have to be 40% over the minimum when the minimum is 15. So that means the cost is not about bringing us up to 15. The cost is about bringing us up to an adequate rate so that we are still in the marketplace in relation to minimum wage workers. We have to be in the same relationship as we are now then. And so all the wages have to go up. And Steve Kroll talked about that, about the compression factor. Also, OPWDD, the OPWDD associations are working together to come up with a number. They came up with $1.7 billion. The OMH system is larger than the OPWDD system. Wow, I'm raging myself. So we have not been able to accomplish that analysis yet. We're going to try to do it, but we're certainly pretty sure that it'll be $1.7 billion, if not more, since our system is larger. And then DSRIP. I just want to say a few things about DSRIP. Over the past few years, New York State has saved billions by successfully curbing the growth of Medicaid. Through DSRIP, we now have potential to put savings from Medicaid back into the health system to hopefully improve care and provide more cost-effective services. However, the financial benefits of DSRIP have not resulted in any significant resources going to community-based organizations. CBOs have contributed time and resources to the development of every PPS project in the state by attending meetings, helping develop these projects, providing ideas, offering services. However, in most areas of the states, the DSRIP money is not finding its way to the CBOs. If we want a system of care that provides quality and choice, we need this to change. We ask that all of you get very involved in the structure of the PPSs and try to, we can work together to try to figure out how we might change some of the structures to ensure that the CBOs are at the receiving end of some of those funds. And the DSRIP, PBS, managed care issues, also very complicated and probably could warrant their own hearing. Thank you.
Thank you.
Question?